Thank you, Mr. Doctor, for your time.
Thank you.
Time is maybe also the thing which is important for Ayurveda and for your conversations with your clients. So maybe, if you agree, my first question is about the time and feeling of people in the Czech Republic of time in connection to Ayurveda. That's a big challenge, I think.
Yes, that's a big challenge.
Yeah.
There are few challenges when we practice Ayurveda here. This is one of the important and big challenge which I am facing here.
Yeah.
Because here people are having the habit of quick fix, and the life is fast.
Yeah.
If I compare with my Indian life, now I am in a fast life. So first of all, I have to take them about the information about the lifestyle, and I used to give them some tips to go slow down.
Mm-hmm. This is something I personally need as well. I'm fascinated with Ayurveda for more than 25 years.
Wow.
So I'm very honored that now I can talk to you and be in this wonderful place. Thank you so much that we can have you in here.
Yes.
And that we do not have to travel to India, but
Yes.
we can use the professional benefits of Ayurveda in here. Maybe if we could be a little bit particular for our viewers and show them how Ayurveda works with their clients, with the patients, because there is another important thing, which is responsibility for your health.
Yes.
Ayurveda, as far as I understand, tries to show the possible ways for the patient.
Yes.
But the responsibility, which way to follow, which path to go, is on the client.
Yes.
Is that right?
Yes, it's absolutely, you are absolutely right. It's not only in Europe or in Czech Republic, it's whole world it is like that way. Ayurveda, we are giving many suggestions to them. It's up to your hand, or it's up to in my hand. If it's my health is my responsibility. So many suggestions are there. If I want to follow it or not, that is the question. So it will taking time. It is permanent solution.
Mm-hmm.
So for permanent solution, we need time.
There are many topics which patients usually solve a lot, and I know it also from the professionals I talk to in the show U Doktorky by the doctor, which you will be also the host. And it's the problem of different inflammations in the body. Could you make some point about that, maybe about the lifestyle, and of course about the energies and complexity which you need to see on the patient to solve at least a little bit that problem?
Yeah, see, it's not absolutely correct if I say general information, but something which will help you if you have an inflammation, for example, some joint problems. So if you're taking the food, the red meat, alcohol, smoking, coffee.
Coffee.
Coffee also, yes. All these things are increasing the inflammation.
Mm-hmm.
These are supporting the inflammation. So you just reduce these things. I'm not saying that to stop it. Just reduce the quantity and see the changes in the body without any herbs. So, and along with that, what I do, I will give some herbs which will help for cleaning, purification. So it will work. It's working.
And it works quite fast, because at the beginning of the press conference, you mentioned some of your experience with clients, and you mentioned a fascinating experience, which was how long until the patient saw the effect? Yeah,
see, there was question, because they're asking, okay, how long I have to follow? After this, I can back to my my normal life or not? That's question.
That's not the answer.
So there is in my experience, I think if you see, Ayurveda is from India, but in India, we are using more spices. Mm-hmm. The spicy, which we are saying, oh, it's spicy. You can't even go nearby that. Yes. And you are saying, oh, it's spicy. We are tasting it, it's nothing.
Yeah, it's mild.
So, it's mild. So the point is, when it comes to Ayurveda, with the dose which we are giving for the children in India, it's working in the adult here. Mm-hmm. Means you are more tender compared to that. Means internally maybe that.
And when you try to find your way in Ayurveda with the guidance of your colleagues, you mentioned that it usually takes just 14 days or 3 weeks until you see the first result.
Yes.
Is that right?
Yes. See, many cases. I mentioned about chronic cases. There are chronic problems and acute problems. If it is an acute problem of a history of 1 week, so somebody has a problem, how much history? 1 week. So you can get result within 1 week or 2, 3, 4 days. Within 4 days you can see.
Which is excellent because the patient could see that he or she is on the right way, and then they know if they feel their body that they are on the right way, on the right track for them, which they are inspired to follow.
Then they can continue. You're absolutely right.
Thank you so much. Last question, and I know it's the most difficult question, and a lot of people are fascinated by that. Was the doshas aspect or pattern? And we saw the 2 animals, the tiger, the elephant, and the gazelle. Could you a little bit comment on how you work in the maybe first consultation with those principles, just very briefly, because I know it's very complex and it's very hard to talk about it.
Yeah, and I am very happy that you know the word doshas, because many clients who are coming, they even don't know what is dosha. So I have to start from there. I have to start from everything. So for example, I will give them with a small examples like vata is like air or wind. It is like blah, 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 blah. For example, a person with vata person is like always with a movement. Vata is always movement. Pitta is very punctual, very sharp. So they can, it's easy for them to connect. Oh, okay, this is vata. Okay, I am having little bit vata. I am having little bit pitta. And kapha is a little bit bringing you down. It's laziness and making you stable, groundness. This is kapha. So when I explain like this, it's easy for them to understand. Otherwise, if I am explaining it in the normal way, it will take many years. I told you, I took 8.5 years to learn this science. And it's not possible to explain them within 1 hour or 1.5 hours.
Could it sometimes be the combination?
Yes, sure. Of course, see, you know, if you're taking 100 people, only 6 or 7% you can see specific vata, pitta and kapha. Other 93 to 94% people are combination. Either vata pitta, vata kapha or kapha pitta. So this combination is working mostly. And there will be priority. There will be more. Sometimes vata will be more, sometimes pitta will be more. Depending on that, we will change the protocol, treatment, herbs, everything.
Thank you so much, Doctor, and I hope that I will see you very soon in the show U doktorky by the
Sure.
Thank you so much. Take care.
Thank you
for your time.
Thank you.
A my vám, přátelé, slibujeme, že pana doktora už brzy pohostíme v pořadu U doktorky, kde si ájurvédu a ájurvédskou medicínu probereme opravdu mnohem komplexněji.